provide for privacy. I'm going to wash my hands. All right, knock, knock, knock. Hi Jennifer, my name is Michelle. I'm going to be your student nurse today. It says here that we have an order to change the dressing for your PICC line. Is that okay with you? She says yes. Can you verify your name and date of birth with me? She says Jennifer Doe, 11/5/75, and that matches. Do you have any allergies today that I should be aware of? She says no, which is correct. Have you ever had this done before? She says yes. Okay, so we're just going to take this old dressing off. We're going to cleanse it, put a new dressing on, and then, are you able to wear a mask for me? She says yes, so I'm going to put one on. Since I touched her face, I'm going to wash my hands. Next, I'm going to prepare my sterile field, so I'm going to open this up and apply my mask. If Jennifer was unable to wear a mask, I would have her turn her head, but we do prefer if she can wear one. So we want to keep this area as sterile as possible. Next, I'm going to apply clean gloves. And we're going to measure the area. We're measuring 6 inches above the site of insertion. And then we're going to measure the circumference of her arm because we want to note any deviations from baseline. And then we're going to go from the site of insertion to the top of the cap. And that is also good. Any deviations 1/2 inches or more could indicate infiltration, extravasation, or deviation, which is also what we don't want. So then next what I'm going to do is I'm going to remove the dressing, starting at the outside and pulling it inward. And if this was an elderly patient or a child, I could use alcohol so it wasn't pulling at their skin. And while I'm doing this, at the site of insertion, I'm going to note for any redness, edema, ecchymosis, drainage, and approximation of all that. And she does have a stabilization device in place, which is good. So we're just going to remove this. All right. And on the dressing, we're going to note for any color, odor, consistency, and amount of any drainage, and there is none, which is good, so we're going to toss that. And then we're going to remove our gloves. Wash our hands. How are you doing, Jennifer? She says good. All right, next we're going to get our sterile gloves ready. Open these up. Sometimes your sterile gloves don't want to work with you. Check your thumb. All right, and these are ready. So what we're going to do, we're going to take sterile alcohol swab, keeping our hands above our waist and not turning her back to our sterile field. I'm going to make this hand clean so I can hold this. We're going to cleanse in a circular motion for approximately 30 seconds, and we want to go 2 to 3 inches around the site. Right, we're going to toss that. All right, and then we're going to get our chlorhexidine ready. So with my sterile hand, I'm going to grab that. My clean hand, I'm going to grab this. We're going to cleanse all around. Alright, so we then throw that away. Set that down. Alright, and my skin prep comes in a swab, so I'm going to use that. My clean hand. You don't want to go close to the site of insertion. Remove our sterile gloves. Wash our hands. Your arm feeling good and clean? She says it sure is. Alright, then we're going to put on clean gloves. And we're going to get our dressing on. And you want to wait for that to dry. Dressing. Says she feels nice and clean. There's no tenderness whatsoever. Making sure our dressing is nice and secure. And then what I do, I would use this to write my initials, the date and time. And then we would put some tape to further secure it. Remove our gloves. Wash our hands. And I would remove my mask. Wash my hands. Remove Jennifer's mask once my hands are nice and dry. Wash my hands again since I touched her face. And then I would want to make sure Jennifer's nice and safe. Her bed is low, her railings are up, her call light's within reach, her head is up, she's comfortable. And like I said earlier, if this was an adult patient or a pediatric patient, we would want to use alcohol to help remove the dressing so it's not as painful and so we don't break their skin. And then I would want to document the time, any assessment findings, and today's date.